overview of our online Master in Nutritional Epidemiology and Public Health. Amanda, can you introduce yourself, please?
Thank you, Rosalie. My name is Amanda Jager, and I'm also one of the study advisors of this master program, Nutritional Epidemiology and Public Health. It's a long word. And besides that, I'm also a course coordinator of one of the courses that runs through the whole 2 years, and it's mainly focused on academic skills.
Leanne, can you introduce yourself?
Yeah, of course.
Please?
Yeah, I'm Leanne Rosalie, and I'm currently in my 2nd year of this online master program.
Thank you, Amanda and Leanne. Today we will discuss a couple of things in our webinar, and it consists of 3 parts: the content of the study program, the structure of the online master, and also about the admission, how you can become admitted to our online master. And of course we have plenty of time, space to answer all your questions, so feel free to post them. Before we start with answering your question, we also have a couple of questions for you, because we would like to get to know you. And we'll start with the first poll, and that is about where you are coming from. So please indicate from which continent you are. And while you do that, we already go to give you an overview where our current students are coming from. And as you can see in this picture, students are coming from all over the world, from Canada to Australia, but also from South America, like Brazil, Argentina, to all over of Europe, but also Asia, like Bangladesh, Pakistan, Iran. Though I must admit that some of our students have moved from those countries to the Netherlands or are staying somewhere in Europe. And I should not forget also Africa. We have students from South Africa, Kenya, Uganda. So we really appreciated that our international master is indeed international, because our students make it international. And that makes it quite unique, I would say. So let's talk about answers. Let's see if we already have some answers coming in from you. Not yet. Then I would like to ask Leanne whether what you see in your current bachelor, or current batch, where your students, fellow students are coming from. What do you see?
A lot of students come from the Netherlands, but there are also students in Canada or Iceland, or it's actually all over the world.
All over the world, yeah. And how does that feel for you to be communicating with everybody around the world?
That's great, unless the part about the time differences, but it's great to see the different students, different cultures, different knowledge. To share that with each other, that's great.
Nice, thank you. Let me check whether we have some new results coming in from our poll. Yes, please. I don't know where to see it, sorry. Oh, no. I think they're mainly from Europe. Yeah, mainly from Europe. That's what I can see from far away here. And of course, that's also demonstrated in the previous picture, what you saw, that most of them are coming from Europe, but it's really international. So indeed, many students are coming from the Netherlands, but also from other countries within Europe. Let's go to our second poll. And that's what we see is that while our on-campus programs mainly attract the students who finish their bachelor program and immediately start with the master program, we see differences in our online master. And that means that our online student population is really more diverse than our on-campus population. So we would like to ask you, what is your current situation? And that means whether you're just about to finish your bachelor program, or maybe already a bit longer ago that you finished your bachelor. And we already mentioned it a bit previously here, Leanne. You see that students are coming from all over the world, but what can you say about the diversity of the student population?
I think when you're in a bachelor program, that it's more one group, one age group, and here you see different age groups, different, like I said before, countries, different cultures. So it's not like a bachelor program that every student is around 20 or 30. We have also students around 50, 60.
Something like that,
something like that, yeah.
That's indeed what we saw also in the other years. And it's really nice. Since the start in 2015, we have really a large range in age. So between, I would say, between 23, 24 years old up to 65 years old. And of course, there are more students from your age group than the older students, but I really appreciated that it's quite diverse. Let me check. Do we already know what the results are?
80% after bachelor.
Ah.
That I completed some time ago.
80% is just finishing the bachelor?
Completed some time ago.
Yeah, I don't see it yet in my display. Just to summarize from our first poll is that we have now viewers from 68% from Europe, 7% from North America, and also 7% from Africa. So that's really nice to see. Yeah, then maybe it's also good to already see what. Okay, thank you. So 75% has completed the bachelor already a while ago, and that's similar to what we already see in our current student population. Time to move to the next poll. Yeah, I can. That is what your current situation is regarding work, family life, etc. So can you please indicate what is applicable to your situation? Yeah, maybe Amanda, can you add something to this? Whether which we didn't address yet.
Yeah, maybe it's also nice to know that there are many people who combine this study with their job. So this is a part-time study. So you can do it either next to a part-time job or to your family life. Some people have a really busy social life that they combine it with. So there are many options, and also in the view of lifelong learning in the context.
Yes.
Yeah. So which is really nice because you bring the experiences from all these years. So Leanne just told us we have people that have that are older, that have work experience for 10 years, but we also have people that are already retired and still joining our program.
Yeah, that's definitely true. Because what we also see is that you might be working already and then start thinking, but I want to do something more, or I want to make my next step or next promotion. And then you may be thinking about, okay, now it's time to do a master, because that will help me to move to the next step or to move to a different work area. I think it's okay to hear the results a bit later. So I would like to ask you, Amanda, to start talking about what is the content of our study program.
Yeah, maybe we can go to the next slide. I'm just asking our technical support because the battery is running low. You can see this is all live
webinar.
Yeah. Like I just said, this is a part-time study, and the way we arrange that is that where on campus you would have 1 full year of courses, now we have split it in 2. So you have 2 years in which you follow courses, and these courses will prepare you to eventually go into a thesis that really fits your interests and also an internship afterwards. Well, during these courses you will closely collaborate with your fellow students, which is sometimes a bit challenging because they're in different time zones, but it's a lot of fun. And you will also get to know the teachers quite well. You will know them personally. Well, in this master, we will teach you the methods how to investigate the links between nutrition and health. So it's not only about learning how to interpret data, but also to get really hands-on experience and do this data analysis yourself. And to illustrate that, I will have an example later on of an epidemiological study. And what we constantly are improving is that we add the latest state-of-the-art data analysis tools to the program. So if you join our program, you will get the newest techniques in your hands, and you will work with that yourself. What I think is also very unique about this program is that it is quite flexible, which means you can decide yourself when you're going to study, where you're going to study. So some people prefer to do it in the early mornings or at midnight when the kids are asleep. That's all up to you, but flexible doesn't mean it's really free. So we have courses that are scheduled at a certain time. There are deadlines that you need to take. And sometimes you have group assignments. And of course you have exams. And those are all scheduled. So you need to make sure that you keep up the work during these weeks. Well, our study is about nutritional epidemiology and public health. And also the nutrition part really comes back. And I want to dive into more in the depth of that. So I will tell you now what dish you get when you choose our master. And I'm going to explain that by the letters of the word dish. And I'm just going to go to the first letter, which is the last letter of the word dish, which is the H. So our program is all about the health of the population, which means that the study of epidemiology is all about the distribution of a certain health state or disease states like diabetes or cardiovascular disease, how that is distributed within the population. So how many people develop eventually a disorder. And the question that people in our program want to ask is, how can we prevent this? So our master is more on the prevention side in comparison to diagnosis, for example, or treatment. So how can we use nutrition and dietary intake to have an effect on the health of the population? So that's the Y of the I in dish. You will also get courses that will teach you how can I measure dietary intake and nutrient intake, which is also quite challenging because, for example, if you have a very elaborate food frequency questionnaire, how reliable is it? How reliable is data that is filled in by people by themselves? Maybe they missed out on something. Well, these two factors are not enough to change eventually the health of the population. We miss one step, and that is the individual. So what we want to know is, what is the effect of nutrient intake on the individual, on the health status of the body? So that is what the S stands for. So status of the physiological body. So you want to know, for example, if I give additional protein to someone who goes into surgery, will this patient recover faster? So you're going to look for mechanisms. So that is also part that comes back within this master. And to make the whole circle complete, it's not only what you take in, but it's also the environment that largely influences what we eat. So for example, the industry or social behavior, these are all determinants, so it's the D from dish, that have an effect on what we eat. So all these factors, they will come together in our master program. And to illustrate it a little bit better, I've also listed some of the courses that you will get, or at least some of the topics that you will get in the courses. So here you see a nice overview of all topics that will come back. For example, epidemiology. You will get a lot of epidemiology in the study, which is literally the distribution of a health status over the population. And in the first year, already in the first period, you will get an introduction into the epidemiology. And during the year and also the second year, the knowledge will build up eventually to the advanced level. So at the end, you're really good at it. Isn't it, Leanne?
I hope so.
Well, epidemiology can be quite challenging, yeah. But you will get the data analysis tools, so you will be able to do this yourself at the end. Well, you also see statistics there. That is also a very important course. But we have dietary and nutrient assessment courses, public health courses, and we also have courses that are not in this overview, but they connect all the different courses together. Well,
Now you've been talking about all of these courses, and Leanne, you are now in your second year, so you've done more or less all the courses from your first year. Which was the course which you really enjoyed?
I never was thinking I was going to say this, but it's actually epidemiology and public health practice. It's a big project actually. It contains 4 weeks, and you have to collaborate with students in other countries, and you are going to develop a public health intervention. And it's a little bit scary because it's like this third or the fourth course
already.
Yeah. So you don't know all your fellow students, so that makes it a little scary, but it's great. The collaboration with your fellow students, it's great. Yeah.
And that's indeed the first course where you have to do the group work together, and it really challenges you. And if you talk about the content of that course, it has to do with public health, and you have to think of intervention programs. So can you elaborate a bit on that?
Yeah, you're going to choose a topic, and then you can make an intervention on that. So I did something on the prevalence of overweight and obesity in children in the US, and they want you to make an intervention that they can use to
implement.
Yeah.
Nice. So you can really think of your own topic, and together you discuss, this is what we're going to tackle.
Yeah.
Nice. So it's really also hands-on then. Nice to hear. Just 1 second for some questions. I'm seeing the questions coming in. I see a lot of questions already about scholarships, and there will be a link displayed somewhere in your screen where you can go to the link from the scholarships, which are either available through university or which gives you the information, more information about scholarships. I also see questions coming in about fees, and we're not going to elaborate too much about the fees today, because the exact information about fees can definitely be found on the website from the university, because it really depends on whether you're a European student or Dutch student, because then the fee is about 2,000 euros per year. And if you're a non-European student, the fee is a bit higher. So it's really good to check the website from the university to see which situation is applicable to you, whether you're coming from Europe or Switzerland, or you're coming from outside Europe. So do have a look on the website, and otherwise we can always address that at a later moment. Some other questions I will save for later, so we'd like to ask Amanda to continue with your story, please.
Thank you, Rosalie. I just told you in the beginning that I will also give you an example of an epidemiological study, just to illustrate what epidemiology really looks like and what you will be capable of if you choose to go for this master at the end of the program. And this example is all about the Dutch meal. So, Leanne, how many times a week do you eat potatoes?
I think maybe once a week.
Is it boiled or is it?
No, no. I'm thinking about fried or baked right now. Yeah.
Okay. Well, the example that I use here is for boiled potatoes. So in the Netherlands, this is a typical Dutch meal. And we are used to eat quite a lot of potatoes, especially the elderly. So we see that for the people that are above 70, they eat, or 50% of them eat more than 4 times a week boiled potatoes. And now we know from other studies that potatoes have blood pressure lowering nutrients, but they also have a quite high glycemic index, which means they are rich in carbohydrates. And because of this blood pressure lowering effect, people started wondering, do potatoes have an effect on cardiovascular disease? Maybe they have a protective effect. So that is what some people in Wageningen, colleagues of us, they have studied. And what is really nice to know is that you see the publication below, that 2 of our master students have also collaborated on this thesis. So this is really an example of something that you could potentially do. Well, if you do research, you always start with either an hypothesis or with a research question, and that is also what they did here. This is their research question, and that is, what is the association between potato consumption and the risk of cardiovascular and all-cause mortality, so whether you die from it, in a Dutch cohort of myocardial infarction patients? Now, to investigate this, they made use of the alpha-omega cohort. And this is a really big collection of patients and their information. It's almost 5,000 patients that are in that cohort. And what they have recorded from these patients is their dietary intake, which was based on a very extensive food frequency questionnaire. And they followed up on these patients. So they had to come in every year, and they were followed for more than 12 years. So you can imagine that you get a lot of data from these people. And what they eventually did was a survival analysis. Well, that is a statistical analysis which you can use to trace over time how many people are still alive. And the decrease in the amount of people that are still alive can be possibly linked to what they have eaten in their life. So that is exactly what they did, and they used software called RStudio for this. So RStudio is kind of a programming software that we will also use a lot in the program. And I asked the researchers to send me a part of their syntax that they used, which is what you see now. So this might seem a bit complicated to you, but I can assure you, as soon as you have some basic knowledge already of RStudio, you can make sense out of it. It isn't really that difficult as soon as you know the logic about it. So this is something that you're going to learn yourself, right, Leanne?
Mm-hmm.
Well, the researchers were so proud of what they did, they also sent me their data set, or part of it, just to show you what does the data look like. So at the first column, indicated by the red circle, you see the randomized numbers. So all these people are anonymous, you cannot trace them back. They got a number, and they were followed up for many years. The blue circle, that indicates whether people are still alive or they have died from cardiovascular disease. In this case, they're all zeros, which means that they are still alive. And for example, they took measurements such as BMI, which is indicated in the column with the green circle. And there are many more factors that they recorded from these people. And I think this data set already exists for quite some time, but there's so many people that still are doing research on it because it contains so much information. Well, let's go to the results. So here you see two typical examples of how we can present results. So either in graphs at the left side or in tables at the right side. And I'm going to just talk you through what you see at the left side in the graphs. So at the top you see the mortality caused by cardiovascular disease. On the x-axis, you see the potato consumption, and on the y-axis, you see hazard ratio. And this is the relative risk that an event occurs. So if the relative risk is 1, it means there's no increased risk compared to a control group. Now, if we look at that graph, we see it's quite flat, and it's still on the one line. So we could say there's no association there. Well, if we go to the lower graph, which is B, and it stands for all-cause mortality, we see a line that's slightly going up. So if you read that correctly, you can see that if you consume a higher amount of potatoes, you have a relatively increased risk of dying of any cause. Well, this result was almost significant, but it shows a nice trend. And at the right side, something similar is demonstrated there. If you can see it, you need to believe me. There they split the group in 3 different parts. And there you can see that the group that consumed the highest amount of potatoes, they have the least person years. Well, this was not as significant, but it shows a really nice trend. And this is, of course, not the end point of it, because what are you going to do with the data? Well, the researchers were able to answer their research question, but that is the start. because afterwards what you're going to do as a researcher is start asking even more questions. So for example, how do these results relate to what we already know? Can relate it to that physical state that I talked about in the beginning. What does it mean for the individual? Can we generalize these results? So this applies to the Dutch people, but can we also use Americans and find the same results, for example? Or is it just a Dutch phenomenon? What is the relevance of this research? Very important, and I hope they also thought about that before they started. And the last example question is, what are the strengths and limitations? And I really like that question, because it is a question that really drives you to stay critical at your own work. And that is also something that we will teach you as an attitude while you're in the master program. So always stay critical and look for the opportunities. How can I do better? How can I improve my research? And also help the others. Well, they eventually concluded, you can already see it in the screen, but I will summarize it, that there's possibly an association between potato consumption and all-cause mortality. And almost 90%, I think, of all articles end with more research is needed. That's also what they end with. So I hope this example demonstrates nicely what an epidemiological study looks like. And I hope that that's also something that you would like to do.
Thank you, Amanda, for this really nice illustration, what is epidemiology really about. And so if you are very much interested in getting to know how to do these epidemiological analysis, then this is the study to look for. Before we really dive into more courses or epidemiology, I have some questions coming in, and that's really time for Leanne to answer the questions, because I have a couple of questions for you, Leanne, which I collected for you. And it's a bit about how many hours per week do you need to spend on your online master. And I know you have some more slides on that, but just to answer that burning question already, it's a part-time study, but what does it mean in fact for you?
I think on average it's about 20 hours, but it really depends on which course you're taking and what your background is, because if I'm doing a course on statistics, it's going to take me a lot of time. But when I'm going to take a course on nutrition, then will be done in 5 hours. So it really depends on what you did before and what type of course it is.
And that nicely links to my next question, because you mentioned if you're already familiar with the topic, and that's because you studied nutrition dietetics in the Netherlands. Can you briefly explain what is the difference between your previous study, nutrition dietetics, and this master? What are the differences?
Nutrition and dietetics was just about nutrition and different kind of diseases and different kind of health patterns. And this master is more about epidemiology. So of course it's about nutrition, but it's not the main focus of this master program. It's really a step higher.
Yeah, I'm happy you mentioned that, because it does all the time the topics are related to nutrition, but it's not going to teach you how to give dietary advice to patients or to clients coming in to you. That's the main difference from the Dutch nutrition and dietetics program, I think. Thank you. Those are the questions for now. Other burning questions will be answered later in this webinar. Amanda, it's time to move on to you again. Can you tell me a bit more about the features of the program? Like we addressed also, that's an online, part-time. What does that mean?
Yes, I will tell you about that. So we talked a lot about what is the content and now how is the structure of the program. Well, let me start with saying that our master is recognized as an international accredited program. So after your graduation, you earn a full master degree, which is equivalent to the one that you would get if you would study here physically in Wageningen. Well, like Leanne just told us, the workload on average is between 21 and 24 hours a week. So it's not enough to study 2 hours at the evening or only in the weekend, then you have to make very long days. So be realistic in that. That is something that we as study advisors, me and Rosalie, we often tell students. Try to combine it, and if you have a full-time job or you work 60 hours a week, please ask yourself, is this something that I can put my energy into it? Because all the energy that you put into it, you will also get back in the group work, for example. We see people that are more involved in the group work, they are also happier with the program. And they have a lot more of interaction. Well, I already told you in the beginning, you can study wherever you want, whenever you want, but there are some deadlines and so. And to illustrate it a bit better, I also have an example of the first year. So this is what the first year looked like. We start with an onboarding in August. That is not a complete month, as it looks like here. That's only a week. So in this week, you will get to know your fellow students that start in the same year. We will do nice on-live introduction games with each other. We'll give you some information, and you get to know the platform better. So it's really getting on board of the program. After that, you directly start with the epidemiological courses, the introductory ones. And you see in blue all the separate courses. So each month, each 4 weeks, you take a new course. And most of the courses are so organized that you have 3 weeks of course content. Then you have a couple of days off to study, and then on the Thursday of the last week you will have the exam. The exam is a remote proctored exam. That means that you're not gonna get a paper exam by the post, but you're gonna do it online as well, with the camera on, and this is something that we already have quite some experience with. Works very nice. Well, all the courses that we have, the knowledge will build up on each other. And some courses will also integrate the knowledge that you have obtained. In orange, you see the 2 research periods. So in Wageningen, we have an unlimited number of research that you can get or can make use of for these courses. And you can either have resits in February or in August. And also in green, there's also a special course. That is the course that I'm together with Rosalie, I'm coordinating. That is all about the academic skills, and that will come back in the first year and the second year, and we'll also have some group work, some project work in the second year. And Leanne just told me that she looks really forward to the group work.
Yeah.
Do you have any project in particular that you look forward to?
No, not in particular, but it's about the interaction with your fellow students. But because it's an online course, so you're not in the same room the whole time. So when you have a project, you're gonna love it. Yeah.
Great. Yeah. So in the second year, you will have 2 projects. One is a grant writing project. So you're gonna come up with your own topic and write what you're gonna investigate, how much money you need, and how you will plan it, for example. And the second project, really at the end of the year, is about healthy and sustainable food-based dietary guidelines. It's also quite a title. Mm-hmm. And what you will do there is, together with a group, you will pick the guidelines, the dietary guidelines from one country, and you're going to check with the literature whether these guidelines are suitable to the country that they're given in. Yeah. And you're going to see if your requirements would be different if you would do the research. So it's a lot of fun. Well, after all the courses, then you have all the knowledge in-house to start with a thesis. And like I've illustrated here, you do the thesis from home. So you don't have to go to Wageningen, but you can do it behind your laptop. Most of the time you get a data set and you're going to do the analysis yourself. Of course, you're supervised by someone from the university, and this person will also guide you and learn you the techniques if you don't have them in your hands yet. And because this is an individual assignment, you're also free to switch to full-time at that stage. So on a full-time basis, it will take you 6 months to complete the thesis. And the same accounts for the internship, which you will do after your thesis. If you do it on a full-time basis, it will take you 4 months. And the nice thing about the internship is you can do it wherever you want. If you're abroad, you can do it at your home place, maybe at a company or a health institute or another university, as long as it's on the master level, of course, and it also fits to the program. But the options are quite unlimited there.
What do you mean with the options are quite unlimited there? But what does it mean? Do you mean that students need to find their own internship organization where they're going to? Is that what you have in mind? So you could do anything what you think of? Can you elaborate a bit more on that?
Yes, I can elaborate more on that. Yeah, your internship is something that you need to arrange yourself. So sometimes we have students coming in from Switzerland and they say, we have this institute here on nutrition and I really would like to work there eventually.
Yeah.
Can I do my internship there?
That's what it is about.
Yeah.
Of course, we can help think with you what kind of internship you would like to do, and there's also a list available where previous students have been to for their internship. So you can always contact those organizations. And with organization, we mean that you could go to another university or to a research institute, but you could also go to a company or to a small medium enterprise, or you can really think of anything as long as your internship is also within the academic standards, within that framework of, how can I say that? I don't know the words now. But that it's an academic topic, so that you approach it in an academic way. So you also have to write a report about it. It's a bit similar to a thesis, the master thesis, but the thesis you really do in-house at the university. Even though you do it online, you're being supervised by teachers or supervisors from Wageningen University. And that's actually the main difference with the internship. That's what you do outside the university. So I hope I've addressed a couple of questions to that. Related to the internship, so we'll think with you, but you'll be the one approaching your internship organization. Oh yeah, there's also a question, Leanne, maybe you can elaborate on that, because there are some questions about, but what is a resit? Maybe we have to go one step back. First about the exam. Amanda already mentioned you would do that online, but what does that mean to do your exam online? Can I cheat while working on my exam, or should I be really quiet in my house? Or what does that mean, Leanne?
Yeah, it sounds a little bit scary, and it was the first time I was scared. But it's actually quite simple, because you're just get yourself in a quiet room, get every note or everything that has something to do with your study out of the room, put on your computer and take your exam. It's not that hard. They will film you and they will listen to what you hear and the noises in the room, but it's quite simple actually.
Yeah, actually that's what it is.
Yeah.
You just have to do the exam behind your computer, and that's what it's about. And let me think, there was one more question. Just have to go through the things. Yeah, there are a couple of questions related to our on-campus master and our online master. So our online master is really about epidemiology and public health. Similar version we also have on campus. So then if you're doubting to study either online or on campus, then that's really the question for you to answer. But you can follow similar courses on that area. But of course that would be more full-time basis, but the principles are the same. So the accreditation, what Amanda also mentioned, it's the same. Then we also have a specialization named Data Science for Health, or now I'm not sure whether I have the correct name, but it's about data science. Currently we have this included in our on-campus Master Nutrition and Health. Next year we'll move forward, and then it will be a separate Master on Data Science. At this moment we don't have the online version for data science. Then the question was, whether in this online master do we touch upon data science topics or courses, Amanda?
Well, we have some data science in it, but it's compared to the specialization and the master that we will eventually have, it's a minimum. Yeah. So the software from R that we use, that really, therefore you need the language of programming, so you'll get more insights into that. But real data science is not incorporated yet.
Yeah, it's
we
not
have some thoughts about it to include it. Yeah.
Correct. It's not incorporated yet, and if you think of combining both epidemiology and data science, then you're always welcome to follow some courses on campus. There are some possibilities for that, of course, depending on your situation, but you may think of that to combine things. And if you really are interested in going into that area, then you can shift or move to the data science part as well, because our teachers are both involved in the epidemiology part, but also on the data science part. So there's some flexibility in there as well. So if you really think about data science, it's always good to check with us. Let me see if I have a remaining question. No, that's it for now. So we can move forward to, well, we have some technical issues here, so we're trying to see whether we can move to the next slide. I'm a bit puzzled now. Yeah, this is about the WUR week.
Now the summary first.
Oh, the summary first. Oh, I'm sorry. Yes. Maybe I can see. There's some questions about eligibility, whether you can become admitted to our program. I will show you in a few slides later what are the criteria for admission.
Yeah, we're back.
That will come later. We'll first go to the overview of the program.
Yeah, so just to summarize what I've just told you, so in the program we have 2 years of part-time courses in which you get all the content that I described in the word DISH, which you see in the menu on the right, so the determinants of health, the intake of food and nutrients, the status of the body, and the health of the population. So those 4 themes, they come back. After the courses, you continue with your thesis, which is 6 months on a full-time basis. Then the internship, and that is 4 months on a full-time basis. And then, based on how you schedule it, the total duration of this master is 3 to 4 years. So if you're still in doubt between this master and the on-campus master is not organized in a way that you can do it part-time. And then it takes you about 2 years to finish it. So this master is really taking care of people that want to combine it. And I think that's really the nice thing about it. And I think that was the summary. Are there any questions about that?
Yeah,
part?
I can add a bit to what you gave as an overview, because Amanda really addressed that you can combine your studies with your work. So the same applies, of course, also when you're working on your thesis or your internship. You can still, in my point of view, you can always still continue with your work during your thesis and internship, because you simply continue on a part-time basis with your thesis or with your internship, which is the second part of your graduation. Yeah. Oh, maybe this is really an intriguing question for you, Leanne. Even though you haven't followed all the courses on epidemiology or data analysis yet, but how do you see it? Is it possible to do this master even though you don't have the backgrounds yet in data analysis or in statistics, in your case also?
Yeah.
How do you feel about that?
Yeah, it's doable, but it takes effort. It's not an easy job to get it done, but it's definitely doable.
Yeah. Thank you. Yeah, and we are aware of that because this is already, we're running this master since 2015, so a couple of years, and we know that our students are coming from different areas, so we also offer some training or background material on the basic statistics. So you get access to that course, and you can do that by self-study, so that prepares you to follow the courses on statistics and also the upcoming course on epidemiology. So yeah, I think it's doable indeed, and also possible even when you don't have any background in statistics. And Amanda, you also mentioned in your example about epidemiology a program called R Studio. What's it about?
Yeah, that is programming software which is freely available. That is why so many people use it. And what is also nice about the program is that researchers all over the world, they share their syntaxes. So most of the time you don't even need to find out your own solution. There's always someone who has already invested time into it. And there's a whole community that shares all these different syntaxes. And if you would compare it to programs like SPSS, it's really different. So my experience with SPSS is that you have a lot of data, you throw it into SPSS and something comes out, but you have no clue what happened after all. Well, this is different with R. So you're going to write your own functions, and eventually you know every step, what you did, and you can also check if something went wrong, what went wrong. So instead of drive or stepping into the bus, you're going to drive the bus. You can visualize it that way.
Nicely translated indeed. And some practical questions for you, Leanne. How often do you meet or do you speak to your fellow students?
Currently, we are in a statistics course, so I get around 100 messages a day or something. I don't read them all.
There's a kind of overload.
Yeah, and we have a groups app, and that really helps. If you are not in a group app, maybe you speak to each other. Every day you are logging in the online environment, so it depends on the amount of time you spend on your study, but the interaction is quite a lot.
Yeah, because you have these discussion fora where you can meet and discuss the study material, and also discuss if you have questions about it when you don't understand and someone else explains it to you. Yeah, thank you. We need to move forwards. So we go to our next slide, and there you see a couple of pictures from Wageningen, because we've been talking about that this is an online master. You don't need to come to Wageningen at all, or you don't need to do the exams on campus, or when you have to do a re-exam, you also don't need to come to Wageningen. But there's one exception, and that is the so-called WURweek. And in your second year, actually somewhere in March, you're supposed to come to Wageningen for 1 week, because at that time you're in the middle of working on your project about a grant proposal, and then we want all our students, second year students, coming to Wageningen to really dive into that project. Next to working on that project, you also meet, of course, your fellow students, but also you meet your teachers or the researchers involved. And on top of that, we also prepare you for how to do the thesis, what the thesis is about, what is the internship about, so about all the requirements, but also about the availability, about topics. So we really inform you. We think very well on that. Should stay modest, of course. And it's really exciting, because I remember when the first time our students came to Wageningen, I thought how that is going to be, because they have never met each other. But that's wrong, of course, because you have been meeting each other for such a long time already, and you really become friends with each other. So that's what the WURweek is about. We guide you around on the campus. We also visit companies such as Unilever, which is some pictures on the slide as well. So yeah, Leanne, you will be working this year together. Due to the circumstances, it will be online. And you've already addressed the group work process. Is there anything else which you haven't addressed yet here?
No, not really. I think maybe you're expecting this is an online course, so you're not interacting that much. But then you're wrong, because it's really about collaborating with your fellow students. So it's an important point. Yeah.
Thank you. Thank you. Let's move to the admission, because there was many questions about that. So we hope to address that here in this slide. You can become admitted to our program when you have completed a relevant bachelor. And what does it mean that you have completed a relevant bachelor? That could be the bachelor like nutrition and dietetics, what Leanne followed, a course of a bachelor on nutrition, nutritional sciences, food and nutritional sciences, about health sciences. So all in this area, then you have a good chance to become admitted. If you think that your bachelor is not that relevant or not that close to our master, then it's always good to send us an email, and the email address will be shown later, because then you can elaborate a bit more, or you can send us your transcript of records, and then we can give you an advice whether you could become admitted or not. Another important aspect for admission is that you need to have good grades, and with good grades I mean that you need to have a GPA of 70% or higher. In Dutch that will translate to a 7 or higher. On the website all the exact details are given. Another aspect is that you need to have also a proof of English. On the website it's also mentioned which test is good enough, so that could be the IELTS, but there are so many other tests which are applicable. So that's definitely a requirement which needs to be fulfilled. Without that English requirement, you cannot send in your application file. So if you haven't done that yet, please plan it in. It might also be that some other criteria are applicable to you. So do check which situation is applicable to you. You need to submit your application file via study link. It's mentioned on the website as well. And please do that before the 15th of June. And if you're thinking now, I still need to graduate around June or July, then you can already still send in your application file, because then we can check your application file and see whether you could be provisionally accepted to the program. And that means that once you have completed your bachelor before the end of August, then you can start right away in September. So do it in time, otherwise you need to wait another year for that. Leanne, why should someone choose this master?
Now, first of all, it's Wageningen. It's the university on the area of nutrition and health, and other things, of course, but mainly nutrition and health. And also the fact that it's an online program gets you a lot of freedom, flexibility, but at the same time it's really nice. It's just like a school. It's not you're on your own and your fellow students are also all on their own. It's a really nice atmosphere, and the possibilities are like endless, and it's an inspiring place to be.
Thank you. There have been some remaining questions, so I'm trying to collect them all here. If we haven't addressed that yet, a resit is a re-exam. So if you haven't passed a course and you want to pass the course, then you need to do a retake, or so-called resit. There was a question about whether it also you can study the differences between certain diets, And that could be, of course, an example of a thesis topic. So you could address that within the thesis. I don't think it's immediately addressed in one of the courses. Of course, you learn about how to measure the dietary intake or nutritional status, but not immediately about which dietary pattern is better than the other. Let me check. So epidemiology is actually about population. Do you also include the genetic background in there? Do you have any idea about that already, or should I answer myself? Yeah, that of course can be also addressed within one of the thesis topics, which you can select later on. Yeah, I think I have more or less addressed most of the question. Oh, this is a nice question, because we are on this pandemic already for 2 years, and we see a similar or same number of students starting this master, so the same since the last 4 or 5 years. So that did not affect us, fortunately. Yeah. Let me see, do we have another slide, Amanda? Yeah. Oh yeah, so I asked Leanne already, but what could be reasons to start with this master? And what we've seen, these are some quotes why students start with this master. It's all about theory, but you really work on that, and it makes it practical and really hands-on. So it feels like studying on campus. It's a small group. We are between 20-30 students who start every year, and the dropout of the number of students is small. So once you start, you want to continue. That's what we see in our study student population. And some other quotes is that it's really nice to work with people from all different countries, ages, and different phases of life. And another advantage is also that you study one course at a time. Let's go to the next. So we'd like to summarize what we have been telling you throughout the last 1 hour. So we've talked about what kind of courses you can expect in our master. So the courses are structured around this dish about determinants which are influencing the intake, dietary intake, our nutritional status, and in the end health, and how that can be studied through an epidemiological way, but also about public health, how we can influence public health and promote public health. So the emphasis in our master is that we teach you on epidemiology and public health and all the factors or information related to that. So you get hands-on. Our online master is an accredited program, so it's the same as our on-campus master. It's based on a part-time schedule, so there's some flexibility in it, but of course you follow courses for 4 weeks and then you move over to the next course for 4 weeks, and it's concluded with a digital exam. After completing all the courses, you move over to the second part of our master, which includes the master thesis and the internship. So that's in a nutshell the overview of our master. If you want to find some more information, then you can always contact us. You can send us an email to bvg.mnh@wur.nl. So there you can ask your question about eligibility, about the content of courses, anything like that. We will have another online session in February. It's a bit different setup than this webinar, but if you still have questions or want to hear it once more, be welcome to our virtual open day. And of course, our website at the university has all the information included there. So we'd like to thank you, Amanda, for all this information, a very nice example on epidemiology. Thank you for your insight information, how it is to be a student in our online master, Leanne. And thank you for watching us. and being with us for this whole 1 hour. Thank you.